Assalamu alaikum. Welcome back to a brand new episode of Health Matters with me, your host, Dr. Fariha Rizvi. I'm a consultant in diabetes, endocrinology, and general internal medicine. On today's show, we have Dr. Naveed Saeed. He's a consultant in public health and chairman of the Muslim Doctors and Dentists Association. He has over 25 years' experience in public health in the UK and in Pakistan. He graduated from the University of Manchester and completed his public health higher specialist training and was appointed a consultant in communicable disease communicable disease control in the West Midlands for the HPA, the Health Protection Agency, which has now become Public Health England, PHE, and is now the UK Health Security Agency with experience in health protection, health improvement, and public health care, really important aspects of public health. We have a few different topics to discuss. Assalamu alaikum, Dr. Naveed, how are you?
Walaikum salam. Alhamdulillah, I'm very well, thank you.
So,
thanks for having me on the show.
No, thank you for being with us today. So, with Ramadan approaching, inshallah, yes. Literally just a few days away, I wanted to recap some important things about Ramadan, just going into the holy month, inshallah, for our viewers. And I would encourage any of our viewers who have any queries or questions about Ramadan, with any medical conditions that they may have, to call in. We have an expert on the line, inshallah. So first of all, though, what I wanted to discuss were the physiological changes. So what happens in our body, in our human biology, which is also called physiology, what happens in our body when we fast?
There's a few things that happen when we fast. There are some short-term changes, and then there are sort of long-term changes that the body sort of adapts to. So obviously, essentially, fasting is going without food and water. So obviously, we feel hungry, and some people then get anxious because of that, especially if you have a routine. Yeah. So if you normally have a routine, sort of breakfast, lunch, or snacks, going without those things, that causes a disturbance in what the body expects at that time. Yeah. And some people, they can adapt to that quite quickly. Other people, they sort of get a bit sort of more anxious around those times until they start to get used to that. I think we've all experienced that in the first few days of Ramadan, when we do start to feel sort of things aren't quite right. We may become sort of angry, as it were, may get a bit edgy, but then after a few days, oftentimes you get headaches and things like that, that the body sort of settles into the new routine, and we adapt to that. So the first few days, it tends to be critical, where the sort of the blood pressure sort of settles down, the water in the body settles down, the other hormones can sort of readjust, the insulin levels, because we're not eating, we're not getting the spikes in insulin and other things, and so all of those things, it takes time for the body to adjust, unless we're of those very few people who fast on a regular basis. And we do know that the Prophet ﷺ recommended that we fast at least, or recommended that we fast twice a week, Mondays and Thursdays, and obviously the white days during the month. And so if we train ourselves throughout the year to fast regularly, those adjustments in Ramadan don't hit us so hard. Yeah. But, myself included, I'm not that strict about it. I don't, something that I would like to do, but obviously, life takes over. But again, there are those things which, if we do regularly, we do help the body to adjust to sort of how Ramadan can affect the body, certainly in the first few days.
That's really excellent advice. So I have come across some evidence that women tend to feel hungrier in the beginning than men. So when you compare men and women, and if they're to rate how hungry they feel, women tend to feel a lot hungrier in the beginning of Ramadan. And then, as you say, with time over the month, their hunger levels tend to settle, whereas men tend to feel just as hungry in the beginning as they do at the end. So that's quite interesting, and that's evidence that I, shove under my husband's nose when it is Ramadan. So that's one thing. And then you mentioned some of the hormones. I think that's really important. So insulin levels being low, that's good for us, particularly if you have a tendency to have a higher risk of diabetes. So if you have a risk of diabetes in your family, for example, and you know that, then having lower insulin levels where we're not eating and so our body doesn't need to make insulin, that's good for us. Cortisol is another hormone that people may have heard of. Normally, if we have, a routine, as you say, our cortisol levels will be higher in the morning and then they'll gradually tail off during the course of the day, so that our cortisol levels are much lower at night when we're sleeping. But with the way the fast is, if we wake up for suhoor and then go back to sleep and then wake up again and then we have iftar later, so that can interfere with our cortisol levels and what we call a circadian rhythm. So the sleep-wake cycle, that does get disturbed during Ramadan, but eventually over 2 or 3 weeks that settles as well, in that your cortisol levels adjust to take that into account. So, and another really important thing is caffeine as well. Caffeine withdrawal, that can make you, as you described, feel tired, headachy, anxious, all of those things. So these are things that are normal. A lot of these things are normal. These are normal body hormonal responses, particularly in the women in the beginning of Ramadan. But everyone can be prone to these symptoms. And we know it's not easy, but it may be getting easier now that it's coming in the slightly cooler months. But you will remember 10 years ago also, it was at the peak of summer with very long days in the UK. So inshallah, we hope that all of our viewers recognise what's normal and what's not normal, and we'll come on to that as well. So do you have, Dr. Naveed, any recommendations about the types of foods people should be trying to consume during?
I do. I'll come on to that in a second, but just in terms of before that, I mean, you mentioned sort of caffeine, and that's a really good point, because I mean, I drink 4 or 5 cups of coffee during the day because I'm working from home, and so what and. I recognise, certainly in the last few years, that I've been starting to get quite a severe headache for the first few days of Ramadan. So what I've tried to do this year is, over the past sort of month, just gradually reduce my coffee intake. So from 4 or 5 cups a day down to 3 cups for the first week, and then 2 cups, and I'm sort of on one cup a day.
Well done.
Let's see if that helps, and inshallah I can sort of feedback sort of next year perhaps whether that actually worked. But the principle is quite important, because it is a very important time of the year, and we want to be present for the whole of Ramadan.
Absolutely.
And then if we don't take time out to prepare adequately, we don't necessarily get the full benefit from it. So much like if you're going for a marathon or going for a long run or a long hike, you would prepare for it. You may take a few weeks to prepare, or do something special the few days beforehand. So it's important that we see Ramadan as a chance where we can really re-engage, and use it not just to recharge and sort of detox, but actually get closer to Allah. So any time lost in sort of ill health means that it's time lost in ibadah, potentially. So and I've been guilty of this in the past, where you get so sort of consumed by life that you just think, I'll get to Ramadan when it gets there. But before you know it, Ramadan hits you, and then you've lost a few days when you sort of take that time to adjust. So it is. I mean, it's a bit too late now for most people. We can still get a couple of practice fasts in. But again, it's maybe something to consider if people aren't in that habit of, maybe in the month or the few weeks running up to Ramadan, make that effort to plan properly. And the hope, therefore, is that if we plan properly beforehand, we're able then to get the most out of it. And that's not just with regards to sort of cutting out caffeine, but eating more healthily beforehand, doing some sort of exercise routines beforehand, so we do become sort of stronger physically, and that hopefully will then mean sort of on that spiritual level we'll have a better connection with Allah subhanahu wa ta'ala during the month, and hopefully inshallah get more out of it and feel more energized throughout the month.
Inshallah, absolutely, really good points. And just to highlight what you said there, it is recommended to fast during Rajab and Shaban, the 2 months prior to Ramadan. It's recommended. They're also holy months. So that's really good, hopefully, inshallah, moving forward, a lesson for us all to not ignore Rajab and Shaban as they approach. Yeah, really important point. So we've discussed the physiological changes that occur during Ramadan. We've discussed caffeine, which is a big area. I think a lot of our viewers will identify with what you've described there. I certainly have reduced my caffeine intake over the last few months as well. It's really difficult, isn't it? Because then if you just down to 1 cup of tea or coffee a day, then when do you have it? Do you have it at suhoor or do you have it at iftar? Because either time will interfere with your sleep, I find. So, there are non-caffeine alternatives, caffeine-free tea and coffee. So maybe it's worth experimenting with those if you miss the hot drink. There's a social element as well, isn't it, to drinking tea and coffee? So that's maybe an option, caffeine-free alternatives. We should discuss some of the dietary habits and the foods that we would recommend as healthy during Ramadan. There's a lot of cultural variation even within our religion of the types of foods that people prepare and enjoy at iftar and suhoor, and the type of things that people look forward to, in all honesty. I think we have a caller on the line, actually. Assalamu alaikum, Islam channel viewer.
Wa alaikum salam.
Assalamu alaikum, sister. What's your question?
I just want to ask you, how can I look better this month of Ramadan? Because I have a blood pressure.
You have high blood pressure, okay. Are you on medication?
Yes, I am.
How many medications, if you don't mind my asking?
Just one.
Just one, okay. And how long have you had blood pressure for?
Nearly 2 years.
Nearly 2 years, you said?
Yeah.
Okay, and is it well controlled? Do you know? Yeah, you check your blood pressure?
Yes.
Okay, and do you get readings of kind of 130 over 80 or less?
Yeah, sometimes it's high, sometimes it's low, but most of the time it's low.
Low, okay. How low does it go?
120.
Okay, that's okay. You don't get dizziness, do you?
Sometimes, not all the time.
Sometimes, okay. We'll come on to this later in the show, but it's a really important point that you've raised there, people with medical conditions who are on medication. So we would recommend that you still take your medication once a day. If it's a once a day medication, it doesn't matter so much when you take it, either the morning or the evening. If it's a once a day medication, it will last in your system for the whole 24 hours. The drug is designed to be in your system. So it's important that you don't miss it. And it may require a bit of trial and error. So you may find that if you take it at suhoor time, because that will mean that you're fasted obviously for the majority, the whole day, you may find that by the end of the fast you're feeling a bit dizzy, maybe a bit drained, a bit more tired. So there may be better that you take it at iftar time, because it will still be working until the next dose. But the most important thing is that you keep checking your blood pressure even during your fast. So you can fast, inshallah. There's no reason why you can't fast, but you must keep monitoring your blood pressure, and then familiarize yourselves with when, heaven forbid, you might need to break your fast. But there should be no reason why you can't fast. Dr. Naveed, have you got anything to add?
Yeah, no, I think, Dr. Rizzi, you've mentioned all the right points. I mean, it's important to recognize, people, they know their own bodies,
Yeah.
they know their own health the best. Again, we talked about at the beginning, preparing for Ramadan. Yeah. If you go on holiday, you make preparations to go on holiday. If you're preparing to go for the Hajj, you do your research before how to do Hajj, how to get the most out of it. That's the way we should prepare for Ramadan. And if we have health conditions, and I know you said we'll talk about it later, it's important that we have those conversations with the health experts before Ramadan. So a few weeks beforehand, make an appointment with the nurse, make an appointment with the doctor, and have those discussions and talk about it. Some people are very, as you mentioned, very well controlled on their blood pressure medication, in which case it may not matter so much. Yeah. Other people's blood pressure medication or other medications can be a bit more volatile and they're harder to control. So that needs a more sort of sensible discussion with the healthcare provider to give you the best advice, really. But again, it's about having those conversations beforehand, and then and if your own family doctor or nurse doesn't know, then advise them about what Ramadan is, what it means, and those things, and then get the advice necessary.
Really good advice. One point though, sister, I'd like to mention, and this is for all of our viewers, anyone with blood pressure, they should have had blood tests at least once a year. And that's to monitor things like kidney disease. That's really important. So there is a risk of dehydration, obviously, during fasting in Ramadan. Although the fasts are not as long as they used to be, it's not as hot as it used to be 10 years ago. But there is a theoretical risk of going into kidney failure with prolonged fast dehydration in hot weather. So as long as you know your kidney function is normal, then that's good. You need to maintain a certain level of fluid intake, and that may not apply so much to you, sister, but other people with blood pressure who may have kidney issues, that's really important. So monitoring your blood pressure yourself before and during Ramadan, and making sure you've had blood tests at least once a year in the year leading up to Ramadan, and you know that everything is okay. And again, this may not apply to you, but people that have heart disease, who are on blood pressure medication, slightly older people who are on blood pressure medication, there's risks of side effects, there's risks of sodium and potassium levels being affected in your blood. So as long as you've had some blood tests when you're well, you know your blood pressure medication works, there should be no reason why you can't fast. But as Dr. Naveed said, you know your body. So, if heaven forbid you're feeling very dizzy or very sick or very abnormal during a fast, you should always check your blood pressure. And then, if you need be, then go to A&E and have a blood test. So that sort of thing I want to just everyone should keep at the back of their mind whenever they're using medications during Ramadan. Be aware of the potential side effects. Thank you so much. Thank you, Jazakallah. So we have a little we have a break coming up. I just wanted to summarize. We've discussed the changes that happen in the body during a fast. We've discussed caffeine, and we discussed blood pressure management as well. A sister just called in with blood pressure management. After the break, we'll discuss a bit more about food and how to keep generally well in Ramadan. Thank you so much, Dr. Naveed. We'll be back after the break, inshallah. Jazakallah. Assalamu alaikum. Welcome back to the second half of our show Health Matters. We're with Dr. Naveed and we're discussing how to have a healthy, productive and fruitful Ramadan, inshallah. So we've covered a lot in the first half of the show. I wanted to touch upon healthy eating during Ramadan. It's an area very close to my heart. What are your recommendations? What do you come across? It's a big topic, isn't it? How to eat well in Ramadan.
And it's a very important topic as well. I mean, probably what's easiest to say, and I think we all know it's what we shouldn't be doing. Yeah. So the bad habits are we're all aware of. So avoiding sort of the very high sugary things, whether it's sweets or drinks, avoiding fried food or deep fried food. Whether it's the pakoras, samosa, or whatever else that we have. So we know what we shouldn't be having, and therefore, and we know that we shouldn't be overeating, overindulging. We shouldn't want to reward ourselves because of the fast, that we then sort of overcompensate and eat too much. So there's a lot of things that we know we shouldn't be doing, but the things that we should be doing is having sort of a balanced approach to what we eat. Smaller portions. Try to eat from the different types of sort of food groups that there are. So fruit and vegetables, bread, cereals, oats, those types of things. We can have meats, in a good source of protein, have fish, have some dairy products if you can tolerate those. You can have a bit of fat and a bit of sugar, that's fine, but everything in moderation. And again, the Prophet ﷺ said that, what we should, when we eat normally, it's a third for food, a third for water, and leave a third of the stomach for air. So it's a good principle that we should have. And so they're the things that we know we should have. But certainly what's important is not to miss the suhoor. So the early morning meal, the breakfast, as it were, that is critical. Not only is it critical from a bodily functioning point of view, it's actually highly recommended from the sunnah point of view. The Prophet said he encouraged us to wake up, have the suhoor, and make the intention to fast. So it is really important to have that. And then during suhoor, to have sort of what we call complex carbohydrates, to have some of your oats, your wheat, and things like that. You can have a good substantial meal if you want, and that's fine. There's nothing wrong with that. Something that will last throughout the day, and so we're not sort of flagging in the evening. And it's critical, to not to skip that, and again, to have some water or enough hydration that will last you certainly through most of the day. So these are the important things to have. And so at both ends of the day, make sure we have a good, strong meal in the morning. And some people, they can't have a full meal, but have a cereal, with these, not the very high sugary cereals, but the things with the oats and sort of longer lasting things, and then sort of in the evening, don't overindulge, because you overindulge, you eat too much. We then are not productive when it comes to as-salah, when it comes to certainly Maghrib, but certainly for Tarawih, we will struggle, and we know that. We've been there. So it is about approaching things with moderation, and I think we all know that in our heart of hearts. But it is difficult with family and with children, or when you've got people coming over, because you want to provide the best for them. And I know in our household, we have this conversation. As parents, we know what is healthy and what we should be having. But the tension is when you've got kids who've struggled through the day, you want to give them a sense of a reward and achievement. And, that some of them like the fried stuff, whether it's chips or, pakore or other things, and so, for the youngsters, that's fine. But, for us that are slightly more mature, we should be more sensible about how we approach that and not make it a routine.
Absolutely. I think what you've said there is so valuable. The thing with Ramadan, which I observe, is that there's a lot of habit and, cultural expectation, and people will say, well, my mother used to make this, or my neighbour makes this, and why can't you make this? And you get into a bit of a tug of war sometimes with the people that want to eat healthier versus the people who are used to a certain spread. So I would urge everyone to try and think consciously about what they're putting into their bodies, and recognize things when they're not healthy and substitute those. So instead of, when I fast, for example, instead of juice or the red coloured sherbet that everyone is probably familiar with, I will have, squash, no added sugar squash, or water with lemon, or a cucumber water or something. And that, then you feel like you're not just drinking plain water, and it's quenching, it quenches your thirst. And I've moved towards maybe eating just one main meal and then having maybe one or two extra things. So maybe just samosa one day or just pakore one day, and then definitely having lots of fresh fruit and veg available, because it's refreshing. And protein, you mentioned, is really important. So there's beans, lentils, they're excellent forms of plant protein. But also lean meat is, perfectly reasonable as well if it's cooked in a healthy way, so grilled, for example. And then complex carbohydrates are really, really important. So whole grains, so if people are eating cereal, they should look out for the whole grain. And that is where the grain has not been processed, so the whole grain is present in the food, and that is absorbed slower. That's a much more natural way of absorbing carbohydrates. So some really important things you've mentioned there, and I would urge all of our viewers to kind of read up on this themselves. There's something we use in our patients called the Healthy Ramadan Plate. So if people Google that, that's freely available. That's more recommended for people with diabetes, but I would really ask anyone to adopt that. I think we have a caller on the line. We have a couple of minutes left till the end of the show. Assalamu alaikum, Islam Channel viewer.
Wa alaikum salam wa rahmatullahi wa barakatuh. I've got a problem with my
sister.
Large intestine.
Right.
I had surgery, and up to now, I don't feel good, and I'm under medication.
Right.
The problem is, anything I eat, I get pain in the stomach. And I've been for the poo test and all that. I'm asked to repeat every 4 weeks. Now I'm really suffering. What's going to happen when I'm not able to eat when I'm fasting? I really don't know. So,
really.
I wonder if there any help out there.
Really difficult. I'm sorry. I mean, I don't know your diagnosis, but it sounds really difficult. Again, the advice would be similar to our previous caller. Make sure you've had some blood tests. Make sure you've seen your GP and nurse within the last few months. There may.
I'm always going to my GP.
You're always going to your GP.
I'm always the test. I'm always referred. Yeah.
So what is important?
I've reached a stage that I soil myself, and now I can control my bladder, so I suffer from incontinence.
Right. So sister, if it the basis of a fast is not meant to be unbearably difficult. I'm sure Dr. Naveed will agree. But if you are, there's no harm in you trying maybe one or two fasts. But if you're finding it really impacting your health negatively, then maybe you shouldn't fast. I'm sorry, we're at the end of our show. Dr. Naveed, thank you so much for joining us. I will take the caller off air, maybe, and speak with her in a bit more detail. Thank you so much, Dr. Naveed, for your contribution. It's been really helpful, really valuable. Inshallah, I wish everyone, yourself, all of our viewers, a blessed Ramadan, and also happy Mother's Day today for all of those celebrating. Inshallah, we'll be back with another show next week, inshallah. Jazakallah, take care.